Everyone's asking, what if this is the next pandemic? But what if that question itself is the blind spot? Because public health sometimes only looks for one type of crisis: overflowing hospitals, mass death, obvious spread. And if those things don't happen, everyone assumes that there was no meaningful impact. But biology is more complicated and nuanced than that. Take the current Andes hantavirus outbreak, for example. There's currently no evidence that this would rise to anything of pandemic level, and that matters, but it's still not the only question that matters. The question is actually sitting outside of the spotlight. What happens when a biological stressor spreads at very low levels through a population and predominantly impacts people with vulnerable systems? This is where reductionist medicine and modern public health models often fail. Because medicine is great at acute organ failure, catastrophic illness, and death. But let's think about it. It's much slower at recognizing things like autonomic dysfunction, post viral illness, endothelial disruption, chronic inflammatory changes, and nervous system destabilization, especially when those impacts spread unevenly across a population. Think about how long it took for the medical community to fully recognize that long COVID exists and was actually a thing. And today, there are doctors that still don't even know it's out there. For some, the infection was mild. For others, it completely changed their nervous system, their energy production, their vascular system. And we've seen this pattern before with other types of infections too. So the question often isn't, will everyone get critically ill? Sometimes the more important question is, who won't recover, why, and what that's going to look like. People who already have dysautonomia, MECFS, connective tissue disorders, chronic inflammatory conditions, and other systemic diseases, they may respond differently to biological stressors than other people, even when those stressors are actually subclinical. A keen time for those of us in the systemic disorder community to pay attention is when people aren't really getting sick, but they might have mild fevers. When people are okay and recovering and healthy, but parts of viruses are spreading. That doesn't mean panic. That doesn't mean every pandemic or epidemic be catastrophic or particularly impact people with systemic disorders, but it does mean that medicine and public health need to get better at spotting and paying attention to what's going on in the blind spot. I mean, we're already forgotten anyway. To my friends who have gotten infections and never returned fully to baseline, this is for you. That medicine will remember you.